Hello everyone. Why prostate cancer surgery today is not what your uncle went through in the past. You have heard this line every Indian household. My uncle had previous prostate cancer surgery. Poor guy, hospitals for weeks, diaper for months, lost all his bladder control, lost his, you know, families lock that memory in a glass box and pass it down like a warning. Always, son, avoid surgeries. Life after surgery is just like health. So let's talk about what exactly is life after prostate cancer surgery. Let's pause right there. The story belongs to another era. Medicine has moved on, but our fear has not. What this really means is we are still scared of a surgery that does not even exist in the same form anymore. Earlier, we used to do the prostate surgery means a long cut, a long hospital stay, pain, the chances of bleeding, recovery that felt like endless. Surgeons used to tool they had their best. And yes, many men lost urinary control and their sexual capacity. It was heartbreaking initially, but here is where people mislead the plot. That was then. It was way back almost 30-40 years. Today, the prostate surgery is a completely different universe. If I say completely different universe, that's mean it has changed the way we do the surgery now. We are talking about laparoscopic and robotic-assisted surgeries that magnifies the nerves 10 times, hand that do not shake, literally robotic precisions, AI helping surgeons plan and preserve the nerves that control the urination and your sexual functions. Tiny keyholes cut instead of big open wound. Now, the patient today, most go home in 2 to 4 days, walking the next morning after the surgery, back to normal routine physical activity or office work or a house-based work in a week, not months. In a week, you have heard it right. So, most of our patients generally are discharged 2 or 3 days. Let's talk about number because science does not work on my uncle said that. Modern laparoscopic and robotic assisted prostate surgeries reduces the blood loss by almost 80 to 85%. Nearly 90% of the patients get their urinary control back in the first 3 months after surgery, if I am not quoting it wrong. Most younger men with a group pre-surgery functional assessment regain their sexual functions too. And yes, that's mean intimacy, confidence, identity, dignity, well, all preserved. So the old idea that the prostate surgery steals your manhood, that is not the truth right now in the 21st century. That is the leftover fear from the previous medical generations and from our uncle or aunt previous memories. And honestly, untreated prostate cancers threaten masculinity and life far more than the modern surgery does. So here is the details nobody tell you about. Earlier, surgeon removes the tissue around nerves just to be safe, just in case they need to clear the cancer to the max. Today, we map the nerves like airport mapping flight path. 1 or 2 millimeters matter. That is how precise things have now become. And this is not only happening in America or Europe or somewhere else in the world. India is right now in the game. Robotic consoles, laparoscopic assistance, surgical training, real-time cancer check, enhanced recovery protocols and the pathway. It is no longer foreign technology and we have been using it for the last 10-15 years. It is here working, saving lives, saving dignity. And your uncle didn't have access to these type of things when he underwent surgeries 35 years back. He had the best of his time. You deserve the best of your time, not his fear. So the next time somebody talks about that the prostate surgeries, what are the pros and the cons and what are the complications, you need to whisper the prostate cancer surgery ruins life. Previously, your answer with calm confidence is that was yesterday's story. Today's story is precision, recovery, and a life full lived. Thank you so much.